Hello, everyone, and thank you so much for tuning in. My guest today is Dr. Thomas Brown. Dr. Brown served on the clinical faculty of the Department of Psychiatry at Yale School of Medicine for 21 years while operating a clinic for children and adults with ADHD and related difficulties. In 2017, he relocated to California, where he sees patients and directs the Brown Clinic for Attention and Related Disorders in Manhattan Beach. Dr. Brown has published 30 articles in professional journals and 7 books on ADHD, and he is here to talk about the struggles that children and adults with both ADHD and Asperger Syndrome experience. I do want to say before we get started that when we talk about a child's area of struggle, it is with the purpose of understanding the reason for the struggle, the why, and how it impacts a person's daily life, including their relationships. Human connection, for example, is key to well-being, and when kids and adults are rejected by their peers or family members who don't understand them or their behaviors, they are deprived of that human connection. So I want you to keep that in mind as you listen to this episode. Now, my conversation with Dr. Brown.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, Dr. Brown. Welcome to the podcast.
Thanks, Karen. I'm delighted to be here.
I'm so excited to talk to you. You know, before you came on, I said I've sat in on a number of your presentations, and I believe the last time I saw you was when we both presented at the Help Group Summit in Los Angeles a couple of years ago, and that was pre-COVID.
Yep.
So it's been a while.
100 years ago, doesn't it?
It feels like it. It absolutely feels like it. Now, you've written a number of books, which I often reference and I recommend to parents and my colleagues, but I want to talk to you about your most recent one. And that's ADHD and Asperger Syndrome in Smart Kids and Adults, 12 Stories of Struggle, Support, and Treatment. And I would love for you to talk about kind of what led you to write this particular book. And you begin your book with the story of Dan.
Yeah. What I got into was for years I've been specializing in assessing and treating children and adults with ADHD. And have been particularly interested in those who have high IQ. And the reason for that is simple, and that is that often the kids who have ADHD and are really smart are not recognized as having a problem with ADHD. They're often seen as kids who are being too lazy, aren't fulfilling their potential. And so I have a special interest in that. It's not like I see only high IQ folks, but I've been seeing quite a few for a long time. And one of the things that's happened is that many of the high IQ people, not a majority, but certainly a significant number of the high IQ people I've seen, and some of these are little kids, some of them are teenagers, and some are adults, also have significant social problems. That they're kind of awkward socially, that they often can't do as well as others of the same age in being able to read the room and sort of see what's going on and why people are getting uptight or why people are getting annoyed with them or why people don't want to listen to them.
Right.
And also some of them tend to get stuck a lot on a few specific things that they're interested in, but they have no interest in talking about anything else. And after a while, I realized that what I was looking at was the number of people who had characteristics of Asperger syndrome. And the other thing I noticed was that Asperger syndrome had been recognized, and we had a whole set of diagnostic criteria for it in DSM-4.
Right.
But then when they put DSM-5 together, the committee decided, no, we're just going to move all of this over and consider it part of the autism spectrum, which I think of as a real mistake. The reason for that is that the vast majority, actually, there are more people with average and above average IQ among those on the autism spectrum than there are with the more severely impaired, developmentally disabled. And the needs of the more developmentally disabled part of that population are very different.
Right.
Needs of the people that I'm calling Asperger. Now, according to the book, I'm not supposed to be saying that anymore.
Right.
I'm simply supposed to say, well, this is someone on the autism spectrum. But I think those who have average or above average smarts, they are being expected to be able to do a lot of other things that you wouldn't expect from people who have much more limited IQ and language skills.
Right. And what's interesting is that the clinical symptoms in children and adults with ADHD are associated, and you talk about this in the book, associated with differences in the wiring of the prefrontal cortex, which is associated with executive functions.
Exactly.
Now, the executive functions that you see in individuals with ADHD only differ from those with ADHD who are also considered Asperger syndrome. Can you talk a little bit about what you see in those two groups and how they overlap?
Okay, well, they overlap a lot. Actually, the studies on this have shown that, well, there's one study, for example, that was done at Harvard a few years back, and they had a group of, I think it's about 140 kids who had, consecutive kids who had been referred to their specialized clinic for autism spectrum disorder. And the 140 I'm talking about were all IQs 85 or above, which means they're in the high average to way above average section of the spectrum. And they did this study with these 140 kids and found that 79% of them also fully met diagnostic criteria for ADHD.
Mm-hmm.
And the thing which was alarming about it is 41% of those had never been evaluated for ADHD or diagnosed with it, even though they had it.
Right.
And I think it comes sometimes, if you've got one big thing that's diagnosed, in this case, autism spectrum, people stop looking for other things. Often do not consider, this may be a little more complicated with some other things as well. And in this case, the 41% who had never received any evaluation or treatment for ADHD, they'd been involved in treatment programs for autism for some time. And so when I read that study, which was published several years back, I thought, I'm seeing a lot of kids and adults with ADHD who also have traits of Asperger syndrome. And I think I would like to talk a little bit about ADHD and Asperger's, even though I'm not supposed to call it Asperger's.
Right. And before, when, you couldn't actually give the diagnosis of ADHD if you already had the diagnosis of autism spectrum disorder.
That's right.
Right.
In the DSM-4, they did fix that in DSM-5.
Right.
So that we're able to make that diagnosis. But the way the committee was thinking about it was that they just figured, well, autism spectrum is a more wide-ranging set of difficulties, and that would just be assumed to be part of the ADHD symptoms would just be assumed to be part of autism spectrum. But the fact is, in DSM-5, they fixed that mistake, even though I think they made another mistake in eliminating the diagnosis for Asperger syndrome.
Right. And you're not the only clinician to feel that way.
No, I think there are quite a few who agree.
Right. You talk about individuals who have above average cognitive intelligence, and in your book, you break up sections into children and teens, young adults, and adults. And are you finding in your research and in your work that the delay in identifying individuals with ADHD and executive functioning struggles has to do with the higher IQ, that they're able to compensate?
I think, part of it is they're able to compensate for the things they have to do in elementary school. But the story for most of the people I see who have not yet been diagnosed with ADHD, but they are beginning to wonder about it, and so end up coming into my clinic, is such that often nobody's really raised that issue with them.
Mm-hmm.
And so, the fact is that I was getting a number of patients, and I see patients not only from California, but particularly with Zoom, people who are coming in from all over the United States and a number of them internationally, who have been frustrated because they were not able to get the help that they needed. And sometimes they'd been diagnosed with autism spectrum disorder, but the ADHD hadn't been picked up. And sometimes they knew damn well that they had ADHD, but the treatment wasn't really addressing the fact that there are a bunch of other things that were tied to this that did not get addressed because it wasn't on the list of symptoms for ADHD.
And that really impacts, how they function in their daily lives.
Sure.
I'd love for you to talk about what that looks like when, you're not addressing that missing piece.
Yeah, because often what happens is that many of the people that I see have been good students pretty much through elementary school, but as things got a little more complicated, when you make that critical move from having one teacher most of the day, which is the case in most elementary schools, to having now 5 or 6 different teachers and having to move around to different classes, and the whole social picture gets much more complex. And you don't have somebody reminding you, now remember, you've got that paper coming up in 2 more days. Have you started on it yet? That kind of monitoring is the stock and trade of what happens in classrooms up through elementary school. And so what happens is that some of these people who have the ADHD are then beginning to get picked up as and just showing more difficulty in keeping up when they get in middle school. Some of them do fine in middle school because the parents are providing so much support and scaffolding for them to be able to cope with their assignments and monitoring their homework. And that is a lot harder when you get into middle school and way harder in high school. But there's some of them who even get into college, and their parents have been providing so much scaffolding while they were in elementary, middle school, high school, that their problems were not fully apparent until they get to college, and they're crashing and burning because they're just not able to manage all that stuff. And then if you add to that the social problems that come with the autism spectrum, the things that are difficult for many people with Asperger's, that's a complication. And so the fact is, I would say most of the people who are being, that at least turn up in my practice, have not, with ADHD and Asperger syndrome, had not been picked up as having Asperger's until the time they were coming to my clinic or shortly before that, because it just doesn't show as much.
And yet you're picking it up later on. Mm-hmm. And obviously because you've seen this profile in so many individuals. And is it the executive functioning struggles that is bringing them in to your practice? Is this why they're coming in?
Both things are important. Many of the bright kids can do a lot of the schoolwork in elementary school and sometimes even in middle school. It gets a little shakier in middle school because they're smart and there's a lot of information they know. But then when you get up into the situation where now they're in middle school and all these different teachers and different students, and the class gets a little more complicated, the coursework gets a little more complicated, that's the time when you begin to see the executive functions. Now, the model that I use, which I talk about in the book, for talking about ADHD is you can write an equation that says ADHD equals developmental impairment of executive functions of the brain.
Mm-hmm.
And that includes being able to get organized and get started, and difficulties in being able to focus and then shift focus when you need to. Difficulties in regulating alertness, which includes being able to be awake when you need to be awake and asleep when you need to be asleep. Being able to sustain efforts. I had one kid who he was on a track team, and he said, my mind's a great sprinter, but it's a lousy distance runner. Talking about how if it's, he said, if it's something I can do in one quick chunk, you just go all out for it and then you're done with it, I'm fine. But if it's something where you can't do it in one quick chunk, it's a longer term project, you have to keep chipping away at it day after day. So that I have a lot more trouble with. My approach then is either hurry up, slapdash, get the damn thing done. Let's not worry too much about quality control here. Or why don't we just set this aside and wait till it becomes more of an emergency? And then another piece of the executive function that I've been particularly concerned about is not included in the diagnostic criteria for ADHD of the DSM-5. And that is modulating frustration and regulating emotions. And so a lot of the patients I see, whether it's just with ADHD or if it's ADHD and also Asperger's, emotions make a lot of trouble for them. It's like, and sometimes it's that they're very anxious and it's fear that just sort of gobbles up all the space in their head.
Right.
Other people, it's a vulnerability to hopelessness and chronic depression. But the fact is that emotions of various kinds, whether it's jealousy or intense anxiety or depression, that's a big piece of ADHD executive function impairments in my mind. And then there's memory. If you ask people who have ADD, how's your memory? Often they say, I got the best memory in my family. I can remember stuff nobody else can remember. You give us some example about some movie they saw years ago, and they can tell you every detail of the entire storyline of the movie, even though they only saw it once a long time ago. Or they can, get somebody who say, I've got 450 songs that were popular back in the 70s, all the music, all the lyrics, all the verses. But the problem that they have, even though their memories are quite good for long-term stuff often for these high IQ folks, is that they have trouble remembering what the hell they were supposed to be doing or what somebody just said. It's short-term working memory that's problematic.
Right.
And then finally, obviously, the issues around being able to regulate action. I don't see a whole lot of people who are just so antsy and can't sit still. But I do see a lot of people who get very impulsive and shoot their mouth off in times where later they say, I wish I hadn't said that or hadn't done that. Or they jump into things too quickly in terms of impulsive reactions. So this whole cluster of executive functions, that's the model that I work with for understanding ADHD. And I think that those skills become much more important. Those executive function skills become much more important as you move into middle school, high school, and beyond.
Absolutely. And I see that a lot in the kids that I see as well. And all of the executive functions you describe, they operate in dynamic and integrative ways.
Absolutely. Yeah. It's not like anyone, I've got a diagram of the 6 little boxes of
right.
The thing I always say when I present the diagram is, look, these are little boxes, but think about each of these little boxes, these 6 categories, as like a basket of related cognitive functions. And that most things you have to do that involve executive function require the integrated dynamic operation of them together. If you think, for example, about driving a car, when you're driving a car, you're not just gluing your eyes to the bumper of the car in front of you. You're watching what they're doing, but you're also checking your rear view mirror and your side view mirror. You're also noticing that there's a truck backing out of the driveway and you got to slow down. Then some idiot has just opened his car door right in the lane you're driving in, and you got to just slow down fast in order to avoid taking his door and leg off. And then meanwhile, a couple of pedestrians are running across the street. The light down at the end of the block is turning from green to red. You got to get your foot off the accelerator onto the brake. And all of these things are having to be integrated. So you're ignoring some things, going back to check some other things, and at the same time trying to pull these things together. So it's the kind of focus that I think is central in ADHD, and we often talk about ADHD as the focus problem, is not like focus on that one specific spot. It's more like focus on your driving.
Right. And I think that's just a beautiful example of how complex it is.
Yeah, it's definitely complex. And the other thing that is often not included in the written descriptions of this is that for the most part, executive functions, I believe, are operating at an unconscious level.
Mm-hmm.
That it's, just like when you first go to learn how to drive a car, you think about every little step of it. But once you get so you really understand how to drive a car and you get a little practice in it, it happens almost unconsciously, not in the psychoanalytic sense of conscious repression, but rather in the more dynamic sense of autonomously. That these are operations that each person usually learns to be able to just take care of, because you've got to do these various things and then react to the circumstances that you're dealing with.
And then the emotions come into all of those things. When you give the example of the car on the freeway, if you're frustrated or angry, you have to regulate those emotions as well at the same time.
I had a patient the other day who was telling me about how he was frustrated in some things that had happened just before he got in the car, and then he was driving and he was behind a car that was just dawdling around at the speed limit, but not anything more, and he wanted to go beyond. And he finally found a space. It was a pretty busy freeway, and he finally found a space where he could do it. And he pulled right around, and just hit the accelerator and moved around this car. And as soon as he got in front of the car, there's a flashing blue light going from the car, and he had just passed a state highway trooper.
Oh no!
And he had some explaining to do, and the trooper didn't think it was funny that he was exceeding the speed limit, and the trooper thought recklessly passing because he was so frustrated, and he was frustrated with the car that was moving slower than he wanted it to be in front of him, but he had started a little earlier, very frustrated with some other things too, and the thing one carried into the other.
Right. Now, when you talk about that self-regulation as that missing piece in the DSM, when we're talking about individuals with ADHD, but you also in your book talk about ADHD and Asperger syndrome, and you talk about the brain's self-management system and then the brain's social emotional system. Can you talk about what you mean by that?
What I mean by that is that there are a number of people I see, many of the people whom I would think of as having Asperger's, are really smart. Their cognitive abilities are way up there in terms of way above average for many of them. And yet they seem socially clueless a lot of times, that they don't understand that if somebody comes into the room wearing a new outfit, and she's very proud of this new dress and or a skirt and blouse that she's got, and she's sort of making a show of it, and ask him, what do you think of this, and do you like my new dress, and he says, I don't think it looks good on you, and on top of that, I don't like the color. And most kids would know you don't do that because it's likely to hurt other people's feelings. But the problem is that somebody whose social skills are more impaired is not likely to think about how that reaction is going to be hurtful
Mm-hmm.
to the woman who's trying to show off her new dress and is proud of it. And often they end up in situations where they open their mouths and say things or do things that are just operating without any awareness of how this is likely to be received by other people. And sometimes it's something that actually is experienced as insulting by the other person. And other times it's not so insulting as it is just clueless. And the net effect of this is often that other people get annoyed with them.
Mm-hmm. And it's not intentional to be thinking about people that way.
They don't have that ability to anticipate how it is. They're not able to put themselves in the shoes of the other person.
Mm-hmm.
And do what most kids or adults their age would be able to do, and that is probably better to just say it looks nice even if you don't care that much about it, or to respond favorably to some things that don't ultimately make such a big difference. And then you end up with these kids who end up, just pissing other people off. I brought a couple of the stories that I'd included in the book with me. And I was just thinking an example of what I'm talking about is of the parents who were talking about their son, Sam, who was 12. And they said, our son with ADHD had been already identified. He's doing okay in his schoolwork now, in spite of his ADHD. And the medicine he's taking for that helps him. But he gets teased a lot and makes a lot of trouble for himself by being too critical of other kids.
Mm-hmm.
Despite what we tell him, he can't keep his opinions to himself. He's always quick to point out when another kid makes a mistake, not only during classes, but also in practices and games with his baseball and basketball teams. He starts middle school in 2 months, and we're really concerned about how we get along socially there. Being able to quickly spout off angry comments or critical comments, often leads some of these kids to feel everybody's picking on them.
Mm-hmm.
They have a hard time in being able to recognize they're in fact provoking the reaction. And it's not just young kids. I had a patient who came in who had graduated from one of the top flight universities for his undergrad work and to one of the better law schools in the country. And he was really proud of himself for being right at the top of his class in both places. But he was coming in and he said, I have now been, I got hired by a really good law firm right out of law school as a result of all those things. But then I ended up getting fired by that firm. I got a job at another firm, and 6 months later, I got fired in that firm too. And in both places, they said to me, we know that you're smart and you're very good at research. But then they cited a number of examples of times when, for example, he got so involved in preparing research about the needs of a client that he was asked to prepare by one of the senior partners in the thing. And then he was supposed to present it, and he got involved in it and then arrived half an hour late with the information for the partner in the law firm who had to be, at that time, was already talking with the person who needed the information.
Mm-hmm.
Or he didn't ever talk with any of the staff members of the law firm office. And then he found out because he just thought these were people who were kind of stupid. He didn't have anything in common with them. He was just going to go about his business. And so there wouldn't be any of the sort of casual interaction with the people who were doing the filing and the people who were working on answering the phones and stuff. And then he learned after he'd been there for a few months that there was a call that had come into the office for somebody who was interested in getting information about him, was thinking of hiring him. And the secretary who was getting the call did not even pass that call on to the senior partner. Said to him, he doesn't know how to get along with other people. You're not going to want to hire him.
And that's unfortunate.
Well, yeah, it sure was. But the problem was he was reaping the consequences of not even bothering to get to know or pleasantly interact in the small talk interactions. And, he was another good example of somebody who was very, very smart. And he had his ADHD under reasonable control, medicines that had already been prescribed for him. But he got himself fired from 2 different law firms. And once that happens, you're obliged to tell the next employer you're interviewing with what happened to you.
And that's why it's so important for us to understand why individuals are struggling the way that they are. And, your book does a really great job of explaining these struggles and, through case studies and case examples. And the thing is that where you don't only focus on the struggles, which you've described in a lot of neurodiverse students and adults, but you also discuss the strengths.
Yeah,
which is so important.
I think that's absolutely critical. And, to be able to help, because what happens is that for some of these uh, kids and adults that I see, they have been so often criticized by other people or disregarded by other people and teased by other people that many of them had a very steady diet of not being able to feel like anybody liked them. And it wasn't based on their not being smart enough, as they were socially clueless. Actually, I've got one of the other things that I included in the book. It's just a brief quote, but it might be interesting to people who are listening. Simon Baron-Cohen runs the Asperger Clinic across the pond in the UK at Cambridge. And he studied a bunch of adults with Asperger's and collected descriptions that they made of what it was like when they were growing up. And here are some of the things that came up again and again. They tend to be loners when they're kids. They don't know how to interact with their peers. Many of them are much more comfortable talking with adults. You watch them when they go into a social situation where they're adults and kids, they will usually talk with adults, but they don't want to talk with kids because the other kids, shun them often. And they said that they were rarely invited to go to their classmates' home, or they'd get excluded from birthday parties where almost everybody else in the class got invited. There's not a lot of social pretend play, but much more focus on building things or reading factual things. I had a kid yesterday who came into my office and was explaining some fascinating stuff about scientific research that was being done, but wasn't able to carry on a conversation about what the struggles were that brought him into my office at school. And he said, all the kids hate me. And, most of them are very good at pursuing their own interests in the things that they're specifically interested in. And they get a lot of facts, but it's a very narrow range of interests. And then finally, often they understood the work, but they didn't bother handing in their homework. And many of them will be struggling that way. They get great test scores, but they have a lot of poor grades because of the fact that they're bored with the writing that they have to do to get the assignments in.
Yeah. And that example that you gave about not getting the assignment in makes me, first think about the executive functioning that goes into getting those assignments done. But something else you've talked about, and that's motivation. And you once gave an example, and that's not often thought about when we think about executive functioning and attention issues, but you gave an example once in a talk about a student who works really hard to get a paper in on time, but may not suddenly care because their girlfriend broke up with them. Right. So they're not motivated. And on the flip side, a student whose interest in completing papers is usually lukewarm may suddenly work harder because it might mean that they're eligible to stay on the sports team.
Yeah, exactly. Those were two examples of the same kind of problem, that the emotions in the first case, the emotions associated with the disappointment in something, and on the other hand, the intensity of the incentive Dan will have to pick up that grade point average if you expect to be able to remain eligible to participate in the football team.
Right. And sometimes that inconsistency in performance can lead to that misunderstanding.
Sure.
When you talk about, kids not being identified until middle school, high school, or even college, and people are like, you're smart. Why are you all of a sudden struggling with these subjects that you did fine in when you were younger?
And it's also true that when you look at the Asperger's population, many of in fact, there's research data to show that many of the people who have Asperger's are not identified until their adult years. And the reason is that they are so smart, they just get around. Many of their classmates don't like them much, but they get a lot of praise from the teachers and from the parents. And then often, for example, there'll be I've had a number of patients who come in because they got depressed when they were in their early 20s. And what it is that suddenly the world outside the world, in a way, this goes back to the student I was telling you about, the lawyer who had done very well in school, but then was not able to keep the jobs because he had not yet learned some of the things that we are usually forced to learn about getting along with other people. He had gotten so much praise for all the things he was smart about.
And, and this is why it's so important that you do what you do. And it's because we want to provide this information so that parents, clinicians, educators, other service providers can understand those students, those young people, those adults with ADHD, with Asperger syndrome, because then we look at the behaviors through a different lens.
Yeah.
And then we can better support them.
Yeah, and it's tricky because we have no medicines for Asperger's. If the person has ADHD and has been identified, sometimes that can help that part of it. But the other thing is you need to spend some time talking with these people and getting examples of times when other people have gotten annoyed with them or have excluded them from activities that they wanted to participate in or groups they'd want to be part of. And often it's just a mystery to them why people don't like them. And it's as though their brains are wired in such a way that they can pick up a lot of subtleties cognitively, but they have difficulty reading facial expressions and being able to get a sense of the emotions that are implicit in the tone of voice and the nonverbal communications, which they're often just not noticing. And that's a set of skills that most kids do not have to have, didactic instruction about.
Mm-hmm.
They pick it up because they watch what other kids, older kids especially, but even other kids their age are doing, and they have a sense of, that's not what he should be saying in that situation. And often what they'll do is they'll say something that may be hurtful to somebody else, or at least insensitive to other people, and just have no ability to recognize what any other person in the room would recognize, that was thoughtless and totally lacking in any appreciation of how the other person might feel about it.
Yes. And it's really important, I think, for parents, for teachers who are on the receiving end of maybe some of those comments, to realize that it's not willful, that the person is not deliberately trying to hurt the person's feelings.
You think this person is so damn smart that they should know better. But the fact is that there are things that are going on that are, it might just as well have been in another language that they don't speak, and that they cannot understand what, that if you just sort of treat it as though there's a foreign language involved in some of the informal communications that constitute a big chunk of how we get along with other people in casual relationships.
Right. And all of those individuals who think differently, who learn differently, and who experience the world in a different way have, as you described in your book, areas of difficulty, but also areas of tremendous strength.
Some of them are very impressive with their strengths.
Yes.
And the problem is that the lack of the ability to read the room, to be able to sense what other people are saying, to get a sense of what the tone of voice change, or the frown that's just come on the other person's face, or the way of sort of just showing a lack of interest or concern, is signaling something that's important to pay attention to. And it would be nice if there are some people I see who have Asperger's, but also undiagnosed ADHD. And often if you can help them with the improvement of executive function by treating the ADHD, change the body chemistry with the medicines, that often that helps some. But as I said before, we do not have medicines that automatically cure Asperger's. And it's important, I think, to, on the one hand, remember the strengths and to appreciate, and it's important, particularly when you're treating people like this, to reassure them that you recognize that they're brilliant in some things and that they've got a lot of talents and stuff, but they also have these difficulties which are getting other people to not want to hang out with them, to be more critical of them, to not choose them when they're putting a team together, to choose, not interested in moving them up the ranks in an organization because of some things that do not come easily to them. And the treatment, in many cases, is to help the person to recognize that that is a problem for them, despite the fact that they've got so many strengths. And then to also help to, and you get, the only way I've found to get to it is get some specific examples of times things have gone amok. And get the person to tell me about the story. What happened? The kids, on the playground today were really being nasty to me. And okay, well, what did they say? They're calling me names. What did they call you? What was going on just before that? And to try and help them to be able to recognize some of the signals that you can, the most kids learn to read spontaneously.
I just love this conversation. And I think that, a lot of the information you provide in your book is supported by science. And I think it's important for parents, clinicians, educators, again, to understand ADHD, understand autism spectrum disorder, Asperger syndrome. And I just want to thank you for taking the time today to talk about your research and about your book. And I hope that listeners will pick up a copy of your book, and I'll definitely provide a link to where they can purchase it in the show notes. And if listeners want to reach out to you, Dr. Brown, for an evaluation or consultation, what is the best way for them to contact you?
My clinic is just called Brown Clinic for ADHD and Related Disorders, and we're located in Manhattan Beach, California. And all they need to do is they can look at the website, brownadhdclinic.com. And they could also just call the office and, inquire and express their interest, and we can provide them with information about how we can work together if they want to do that.
Wonderful. Thank you so much. And again, thank you for all the work and all your contributions to the field.
Well, I appreciate your including me in this presentation, and thank you.
I want to thank Dr. Brown for his time today. And I want to say again, as I did at the beginning of this episode, that the reason why we identify areas of difficulty is so we can increase understanding of the struggles that many young people face. At the same time, it's important to highlight and celebrate the amazing strengths, interests, gifts, passions, and aspirations of children who learn and think differently, autistic individuals, and those with ADHD. We want to accept all aspects of their being, provide support that is needed, and help them to develop confidence, embrace their uniqueness, and live a life that is meaningful and fulfilling. Thank you so much for listening.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.